our Honorable Cabinet Secretary, Hayden Duale, my fellow colleagues, our partners, the brave cancer survivors, and all of you wonderful ladies and gentlemen, good morning. Good morning. My CS, I'm not very happy when I'm standing here because of the many people we are continuing to lose in this country to cancer, not specifically to cervical cancer. In my own family, I have lost 3 people already, my 2 sisters and my dad. But I'm also happy on the flip side. I'm pleased because we are launching the Kenya Cervical Cancer Elimination Action Plan for 2025-2030. At least this is going to give us a guidance and also allow us to pull up our socks. And this plan is about protecting our mothers, is about protecting our sisters, is about protecting our wives, our daughters, and friends, so that no woman dies from a disease that we can prevent. That should be the bottom line. Again, if you think about it, this plan, it just didn't fall from the sky, but it started last year during the Cervical Cancer Awareness Month in Nyandarua. Waziri, I have always followed these people, and especially this month, Gladwell and myself, we are always together, and they give me data. I become their communication person. So last year, we had folks from all walks of life when we came together to talk about the plan. And I'm glad that this is happening today. So we've listened to doctors, community leaders, and everyday Kenyans. Now it's time to turn those talks into real action, because when we work as a team, like how our Harambee spirit built this nation, then we can achieve anything. It is not a one-man show. It is not a one-department show. It is not just a ministry's show, but it has to have the hands of everybody coming together. Go out there and tell the women to go for screening. Cervical cancer hits hard in Kenya, and it takes away too many women who are the backbone of our families and communities. But the good news is we can prevent it. So it's not like some mystery illnesses. We know how to fight it with vaccine, with checkups, and early treatment. Yet every day we have seen ourselves losing the mamas in Kisumu, in Mombasa, and everywhere. We can't wait anymore. So let us act now. And I am happy we are starting it here in the city. Let us fold our sleeves and let's go to the communities. Waziri, we must leave the boardroom. We must go to the communities. We must get where the women are. We must go to those schools. And I'm happy with what Daktari has said here, that in Kisumu, he can almost tell that in his constituency, so-and-so's child is vaccinated, and this and that woman has gone for screening. Let us have that. The fight isn't just for hospitals here in Nairobi or big cities, but it's about public health in every corner of the country. So we need to teach people how to stay safe, catch problems early, and get communities involved. Our community health promoters, who are the backbone, they are real heroes. And we will continue encouraging them. And as I stand here, I still want to encourage them. I would have wanted some of them probably to come here to hear it for ourselves. And when I arrived, the first question I asked Gladwell, why didn't you invite community health promoters? So, but I want to say that their work is door to door. So we will encourage them to continue telling the women to come out in the villages, and also we will train them. We will incorporate training around cancer so that they can be able to give basic health education to the women. I want to give a big shout out to the team that has done this work. You've done amazingly well, led by Dr. Bashir. Congratulations. A round of applause for them. And I want to promise you that from our side, the State Department for Public Health and Professional Standards, we are all in. We'll work hand in hand with the State Department of Medical Services, county governments, and partners to make sure that everything is done right with no shortcuts, and we see real results, like more women in rural areas like Turkana getting free screening. I know Waziri will speak to that around SHA. Ending cervical cancer sounds tough, but it's doable. Remember how Kenya rolled out COVID-19 vaccines, even to the hard-to-reach areas. We must do that to the millions of women looking up to us. Therefore, we can do the same. It's time to move from words to action. It's time to move from the actions from the table into action. And with those few remarks, I want to thank you very much. God bless Kenya. And it's now my singular honor to invite Waziri to come and speak to you.